All right, so the ascending aorta, the aortic arch, and then this is descending aorta. So it's descending through the thoracic cavity. This is the descending thoracic aorta, and then this is the diaphragm. So where it goes past the diaphragm, now this is the descending abdominal aorta. Until it gets to this split, and where it splits, those are the common iliac arteries. So they come down here, and then at some point here, it's a little bit hard to tell, they become femoral. So in here, this is all femoral artery. Then right about here, it's behind the knee. That's the popliteal artery. And then it divides into, I think you have to know anterior and posterior tibial. That's what you have to know for the arteries. So up here, so what, from the back, what comes off the aortic arch, there's really three vessels. This one is now we're on the back, this is the right brachiocephalic, and then the right brachiocephalic splits into a carotid, and then this one continues as subclavian. On the left side, the carotid, there is no left brachiocephalic, and the carotid just comes straight off, and then the subclavian comes straight off. So the carotid actually splits. This is the common carotid, then it splits into an internal carotid and an external carotid. So this is like the scalp blood, and this is blood to the brain. Okay. So then the subclavian, when it gets into the armpit area, becomes the axillary artery. And then when it gets into the upper arm area, it's the brachial artery. And then it splits, and the one that goes, we're in anatomical position, so the one that goes lateral is the radial, and the one that goes medial is the ulnar. What other arteries do you have to know? You might have to know splenic artery, which is this one going off up here. You might have to know hepatic, which is the one coming up to the liver. And you may need to know renal. No? Okay, you don't need to know any of those? All right, okay, fine. We'll let that go. Okay, so now we're going to veins.